Those rising numbers are why Ontario is now in its second stay-at-home order of 2021. Premier Doug Ford said yesterday the province-wide order will last for at least 28 days. People have been told they can only leave home for essential reasons like exercise locally, grocery shopping, medical appointments, or to get a vaccine. All non-essential businesses are closed, and big box stores like Walmart and Costco have to close sections of their stores that sell non-essential goods. CBC News spoke to people in Toronto today about the latest pandemic measures.
It should not have gone to this point. There are countries and cities that have been more proactive, and they are not in this current state as we are. People are tired of all the repeated opening, closing. Just make up their mind, do one thing.
Yeah, I mean, it does cause an inconvenience, but it's everywhere in the world, so it's fine.
It's too late. It should have been done long time ago when it was cold. You're going to stay in. Now it's too nice, and it's supposed to be 19 today. Are you thinking people are going to, even though they don't go to work, they're going to be down on the beach, the harborfront?
Anthony Dale joins me now. He is the president and CEO of the Ontario Hospital Association. He's joining me from Toronto. Anthony, welcome to the Rundown.
Pleasure to be here.
Do you agree with the woman that we just heard from that it's too late?
No, it's never too late, but we're in for a very difficult month. The OHA, Ontario's hospitals, strongly support the decision to declare a state of emergency and issue the stay-at-home order. We are making advanced plans, I would say, at the moment to deal with a huge wave of patients requiring access to hospital-based care and critical care in particular over the next 2 to 4 weeks. So people should not be under any illusion. Our hospital system is, it's really just a question of how significant the impact is going to be. We can probably count on at least 700 COVID-related critical illness patients in ICUs by the middle of the month. Without the stay-at-home order, we were certainly looking at about 1,000 in critical care with COVID at the end of the month. These are kind of huge numbers and massively disruptive to our hospital system. This situation is the most serious it's ever been in Ontario's history.
700 could be in ICU by the middle of the month. What does that mean for the system?
I think people need to brace themselves for some shocking but necessary decisions made by hospitals and the people who work in them and by our different government authorities. The system has to mobilize to address the highest amount of risk in the most effective way. With those kinds of with that huge number of COVID patients, they're going to need intensive amount of health care to stay alive and recover. In a situation like we're in now, it means redeploying staff from all over the hospital sector in order to do that. We've said this before, and we've said it again, and I'll say it on tonight's show. The hidden cost of this pandemic is the cancellation of so much scheduled or elective surgery and diagnostic services. Just because something is called an elective doesn't mean it's optional. It just means that it can be scheduled on the calendar, but it still might be necessary to keep someone alive or maintain a high quality of life. And at this juncture, I have to say the amount of disruption will be very, very, very significant, unfortunately.
Are you seeing that already, where people are losing their lives or their health because they can't access the system because COVID patients have taken those beds?
Well, certainly there have been studies throughout the last year that certainly suggest that there's a heavy price to pay for people who are unable to access that kind of care. And at the moment, we're looking at a backlog of surgery of approximately 250,000 over where we should be compared to last year. So that number, unfortunately, is only going to grow and grow quite significantly. Ultimately, this is not about do we have enough money. It's not a funding issue. We're so grateful to the province for giving our sector financial stability in the last budget. This is about redeploying an enormous number of healthcare professionals and workers to try to save as much human life as possible. I recognize that these are very, very strong words, but I have to tell you, this is reality. The planning and preparation is well underway in the province of Ontario across our hospital system for this scenario. And we're certainly looking at a punishing scenario. It's already extraordinarily difficult with 523 patients in ICUs with COVID-related conditions right now. At 700, at 1,000, it will bring our normal operations of the hospital system to a standstill.
Give me that scenario, 1,000. I mean, what does it look like at 1,000? What kind of decisions do doctors and people like yourself have to make?
Well, this really is a clinical matter. And under those kinds of conditions, and I will say, I have to be quite clear here, the stay-at-home order will have a positive impact. And so it will probably have an influence on the number of people requiring hospitalizations and intensive care, but not until really the end of this month, given the gestation period for the virus. So I hope it doesn't get to 1,000, but even 700, middle of the month, and it sort of plateaus there, that is enormously disruptive to operations, as we've discussed. But it also means the widespread transfer of patients from hospitals that are facing very heavy occupancy pressures. Many will be overwhelmed. We know that empirically, which is why we use the critical care command system to and our best clinical leaders to make decisions about patient transfer, because patient transfer is already a very heavy used tool in order to make sure people get equitable access to critical care. That means you're able to get life-saving care no matter where you happen to live in the province. But it does mean that you may have to be moved to a facility out of town, even quite far across the province, in order to guarantee you that access. That will be under increasing strain over the next several weeks, but hospitals and the different authorities will do everything possible to make sure that there is that equitable access. But to the point that I know you're driving at, we do know that the critical care tool is on the minds of many people in this province. It's certainly on the minds of our physician leaders, our clinical staff, our hospital leadership. And essentially, it's an ethical tool, an ethical framework that would help clinicians make the most challenging decisions of their life, which is how to use scarce resources to save as many lives as possible. And so that is under active consideration right now. We know that is the case. The minister has commented on that publicly. And I guess our message truly is we have to plan for this scenario, but we hope in our hearts, we truly hope in our hearts that this does not come to this, but we must plan for it.
I want to be explicit to our audience of what we're talking about here. Are we talking about doctors looking at more patients that they can handle and having to make a choice about who gets a ventilator, who gets oxygen, who even gets a bed, and who doesn't?
At the end of the day, that is quite a serious possibility in some of our hospitals, yes.
All right. Well, we'll wait for the protocol on that. That must be extremely challenging.
Well, it's challenging for us at the OHA, but that is nothing compared to the requests, the demands that we're making as a province on our clinicians, our physicians, our registered nurses, our respiratory therapists who are going in every single day on the front line. And we've heard so many patient stories, especially in the last week or two, about what it's like to try to care for patients, but know that they don't have a chance, and how to communicate with their families and how to keep them as comfortable as possible. The variants are wreaking havoc on the health and safety of the people of this province. And I have to tell you, I simply don't know that everyone in the province fully appreciates what is about to happen.
Right. Anthony Dale, President and CEO of the Ontario Hospital Association, thank you for joining me today.
Thank you.
Very best of luck to you and all of the healthcare workers in Ontario and across the country.
I appreciate it.